Scotland's Health Secretary has said Glasgow's NHS board will be subject to special measures following the deaths of two children. Mason Djemat, 3, and Millie Mayne, 10, both died while undergoing treatment for leukemia on a ward later found to have been affected by water contamination at the Royal Hospital for Children, RHC, part of the Queen Elizabeth University Hospital, QEUH, campus. Health Secretary Jeane Freeman and the board themselves have both since apologised to their families. However, Ms Freeman said NHS Greater Glasgow and Clyde, NHSGGC, would be escalated to Stage 4 of the NHS Board Performance Escalation Framework, meaning it would be subject to an oversight committee chaired by Chief Nursing Officer, Professor Fiona McQueen. In a letter to the Scottish Government's Health and Sport Committee, Ms Freeman said the action was necessary to strengthen public confidence. She wrote, "In light of the ongoing issues around the systems, processes and governance in relation to infection prevention, management and control at the QEUH and the RHC and the associated communication and public engagement issues, I have concluded that further action is necessary to support the board to ensure appropriate governance is in place to increase public confidence in these matters, and therefore that for this specific issue the board will be escalated to Stage 4 of our performance framework. This stage is defined as significant risks to delivery, quality, financial performance or safety, senior-level external transformational support required. The intention of the escalation would ensure appropriate governance is in place to increase public confidence and strengthen current approaches that are in place to mitigate avoidable harms." Mason Djemat, left, and Millie Mayne, pictured with mum Kimberly, left, both died while undergoing treatment at the hospital. It continued, "As a result, an oversight board will be put in place, chaired by Professor Fiona McQueen, Chief Nursing Officer. Professor Craig White will continue to lead and direct the work required to improve the provision of responses, information and support to patients and their families, and also to explicitly support improvements in the delivery of effective clinical governance and assurance within the directorates identified through the work carried out to date. This will be augmented with specific support for infection prevention and control, communications and engagement." A whistleblower from the hospital came forward earlier this month, telling Labour MSP Anas Sarwar there had been 26 cases of infection, with Millie being among those hit. Scottish Labour Health spokeswoman Monica Lennon said the measure puts the future of the board's leadership in doubt. "This is a long overdue intervention in a health board which has lost." For more on this story, visit the news article link.